Great. So, welcome everyone to another wonderful episode of The Vibe Live. A very, very warm welcome to our guest speaker for today, Dr. Bharti Kalra, as you all can see her. And The Vibe, Women Inspire, Build and Enhance, is basically a platform dedicated to fostering women's excellence. It brings together women doctors from diverse specialties to share knowledge, leadership experiences, and personal journeys that inspire growth and collaboration. There are four fundamental pillars of the vibe: physical well being, mental health, financial wisdom, and professional excellence. Through various initiatives like these, the vibe strives to build a community of women professionals that uplift one another and redefine the landscape of healthcare leadership. I'm Dr. Ritu Jori, consultant diabetologist and metabolic expert, practicing in western suburbs of Mumbai. I have a unique diverse background with almost a decade and a half spent in pharma industry and now last half a decade practicing diabetes, thyroid and obesity. Besides clinical practice, I love contributing to research and medical writing as a co-founder of a marketing agency called Rflect. I also want to share with you that I'm blessed with being complemented by my husband, who's an orthopedic surgeon, and a family feels complete with a teen son and a 3-year daughter. But what brings me the most pleasure in sharing is the introduction of this exclusive initiative, The Vibe, as a founder of one of its kind platform that completely targets on fostering women excellence. With that, let me introduce you to our vibrant teen vibe, Dr. Lotika.
Hello, I'm Dr. Latika Purohit, a diabetologist and a lifestyle medicine physician practicing in Colaba since the last 30 years. Besides this, I'm the visiting faculty at the JJ Group of Hospitals and now an elected member of the National Executive Committee of RSSTI. I have earlier been the past president of Maharashtra chapter, as well as I am an avid Rotarian, have occupied various leadership in the Rotary field. Besides that, I'm a mother to an artist and an entrepreneur, and I am partnered by my husband, who's also known as the Sugar Doctor. Now I hand over to Dr. Kavita Rani for her introduction.
Thank you, Dr. Latika. Good afternoon, ma'am. Namaskar, everyone. I'm Dr. Kavita Rane. I am the founder and CEO of Diabetes Total, which is a diabetes and obesity management clinic at Rane Hospital and Apollo Spectra Hospital in Mumbai. I have been practicing for the past 15 years. Apart from work, I love painting, drawing, abstract art. I love listening to music, EDM being my favorite. I love to play golf and I love to travel with my family. And Vibe Live Wednesdays, Vibe Exalogue is my favorite. So over to Dr. Pranjali.
Thank you so much, Kavita. Good afternoon, everyone. I'm Dr. Pranjali Shah, Director and Chief Diabetologist at iHeal and Act Diabetes Clinic. It's in Mulund. I believe in community awareness, and through that, we do a lot of community awareness camp and prevention of diabetes. I love treating young diabetic patients, helping them live longer and stronger. But if you don't find me in my clinic, you will see me hiking, farming, playing with my pets, and hiking with my boys. And these Wednesdays are really interesting, and it is inspiring to connect with lovely ladies like you, ma'am. So thank you so much, and over to you, Dr. Rukia.
Hello, ma'am. Welcome to the Vibe Live. I'm Dr. Rukia Surya Sheikh. I'm a diabetes, thyroid, and an obesity specialist. I've been practicing in Mulund for a decade and a half. I'm also a mother of two daughters. One is in grade 10 and the other one is in grade 6. So life outside this clinic is equally busy and joyful. I'm married to a medical oncologist. So we have medical conversations which even continue at our dinner table. In my free time, I enjoy working out. I love playing carom and meaningful conversations which are filled with laughter. And lately, I have started painting. It's my way of adding little color and calm to the chaos of daily life. It's so wonderful to be here among such inspiring women doctors today. And we are absolutely honored for you to be here. Thank you so much for accepting our invitation and being here today on the Vibe Live.
Thank you so much. So, what we work every day to improve the health of individual patients as doctors? There are women leaders who are actually transforming how we understand and manage women's metabolic health. This week, we bring in an expert who has dedicated her work to advancing women's reproductive, metabolic, and intimate health with a special focus on gestational diabetes, one of the most important yet under recognized challenges in maternal health today. As a respected obs-gynae, she combines clinical insights with compassionate care to address women's health across pregnancy, hormonal transitions, and intimate well-being. This week's Five Hexalog with Dr. Bharti Kalra. Welcome, ma'am. Join us for an engaging and insightful conversation with her today on Menopause Unplugged, Navigating Hormones and Health Flashes. Madam is consultant at Bharti Hospital, Karnal. She's done her fellowship in sexual medicine from MHS Nasik. She's a fellow of RSSDI, has been the past president of the Karnal of Gynae Society, this is COGS. She's also the founder member for the DIPSI, which is Diabetes and Pregnancy Study Group for India. She's a scope certified in obesity management, has almost over 80 PubMed index publications, and her special interests are high risk obs and, of course, GDM and, of course, menopause, which is the segment that we're going to discuss here. So, with that, a very, very warm and wonderful welcome to you, dear ma'am, for your wonderful time here. And quick question: how did you feel when you were invited to be on the vibe?
On top of the world, because
So sweet.
when women invite women, so
That's so
that's the
true,
best
ma'am.
thing.
Yeah,
There is
that's
nothing competitive. So it's
yes.
collaborative. So that's the most inspiring thing.
Wow.
Oh,
Love that, ma'am. I
that's
just got goosebumps. Wonderful.
yeah.
So, with that, ma'am, I will pass on the program further. And may I now request for Dr. Pranjali to take up the first segment?
Yes, thank you, Ritu. So, good afternoon, ma'am. So, my first segment, I'll be talking about your journey from delivering baby to how you have shifted to a comprehensive care in women. So, when we see gynecologists, they are more into pregnancies, periods, fertilities, and all. But what happened and how did you switch to metabolic health disorder and how you started your journey to focusing on this type of issues?
It's a nice question, but I want to correct it. I have collaborated it with the obstetrics practice.
Okay.
It's not. I have not shifted to that segment.
Along
I am
with, yeah.
doing deliveries. Yeah,
Yes,
I
yes,
am
yes, yes.
doing deliveries, cesareans, all this obstetrics all, because
Yes.
we find that our medical care is fragmented. Means if I am only obstetrician, I am taking care of deliveries and all women problems like just related to that aspect only, contraception and family planning that way. But
Yeah.
if the patient coming to me has some other problem, because just like obesity and PCOS, all these things are rampant, increasing in our society. So for that, if I refer them to you, go to another patient, another clinician, that means
Yes.
our care is fragmented. So if we want to give comprehensive care, so for that we have to learn other specialties and other fields also, which are very important for our day-to-day practice.
Yes, ma'am. So, ma'am, do you want to explain any particular case where you realized, see, it is not only about pregnancy, women's health, metabolism. So, there are multiple factors which determines women's health. So, do you want to mention any specific case after that you realize, no, I should be focusing on the metabolic health, holistic care for particular women rather than just focusing on the pregnancy?
Yeah, I remember if we consider that menopause, just giving an example of menopause, and means all this is a holistic approach. I still remember the lady in the 45 years of age, she came crying to my OPD. She was just at the entrance and she was just crying, very badly crying, and her husband was accompanying her that I don't know what is happening to her because she is all the time sad. And when she came to me and she told me that my husband and family, they all are upset with me, I want to commit suicide because I am not useful to my family. So that was the point when I learned that this aspect is very important, which we usually neglect. We give them medicine and then leave them. So that means she needs compassion, not from her family members, because family members husband may be cooperative at some time at times, and at times he just gets frustrated. So for that patient we need mental support. We want her to give her mental support. We want to show compassion, empathy, compathy. So all these aspects are needed. Plus,
Yes.
for giving her medical care specific to her needs, we need medical knowledge also. So that was the point when I added menopausal care to my practice, and psychological care, means mental health portion was also included in that. And along with it, I found that for that particular patient, sexual health was very important, that was neglected. So this thing motivated me to go for the involving sexual health in my practice too.
So,
So
ma'am, do you in your practice when the patient comes to you, so do you see each and every patient or maximum patients who are actually suffering with mental health issues or any depression? This is very common with hormonal, postpartum depression and hormonal changes in the body. So, do you recommend those patients, or do you have some checklist where you send them for a counseling or something like that regularly for your patients?
yeah, I like to spend time on my patients. It's not the, even if it's a hurried OPD, even then I like to spend time with my such patients. Especially, I give them special time. So in practice, I just tell you, I keep tissue papers, not for just other cleaning. That is for patients to wipe their tears. Because nowadays we don't find girls coming with the hankies. They don't have hankies. They just wipe with their dupatta or just doing like this or that. So daily we need that. That is the gravity of situation. You can understand, because
Yes.
there is so much suffering in women's life, not only the pregnancy related, not only the infertility, other aspects also so disheartening. So they need care.
Yes, and they
So,
need somebody to listen to them
yeah.
patiently without
So they
having.
want, first of all, they want therapy by ear. There must be someone to listen to them. No one is there in their family or otherwise at workplace to listen to them. So we have
Yes.
to give them healing ears. So I counsel them. But if I find that they need specialized care, then I refer them to mental health specialist. If someone is complaining, I want to commit suicide, I want to go for divorce. So if situation becomes that bad, in those cases, we need specialist help.
Excellent, ma'am. So when I think mostly when we talk to the patient, we get more than,
Yeah.
when we communicate with them, we get to know their history and the line of management also.
Yeah, we are first person of contact. So the segregation is at our level, na, where we find that that person needs specialized care. It's not, we just don't put any checklist except for when her marital problem is there, or she is getting a problem in getting married, or that kind of issue is there, means where her social health is being impacted, or she has suicidal ideation. That extreme needs, definitely needs
Need
specialist
specialized
care. Yeah.
and yes, yes, yes. Thank you so much, ma'am. And now next we'll move on to the next segment, Dr. Kavita, to take care. Thank you, ma'am.
Thank you. Thank you, Dr. Pranjali. Good afternoon, ma'am.
Hello, good afternoon.
Um, what you were talking about, the tiny details where you keep the tissue, that is so cute, rather, and very generous of you to be so sensitive towards your patients, ma'am. I mean, we got to learn so much. Now, let's move on to the next segment. This is about real practice, where pregnancy, metabolism, and about modern expectations. In today's practice, women often come with internet information and strong family expectations. What situations in the labor room truly test communication skills?
At every step, even before going to the labor room, just at the start of pregnancy, the communication starts, because this is not a just one day job, it's a continuous process. It's a at least 9 months journey in which we have to, after 9 months, we have to give them results. So in booked patients, the communication is built up from the very beginning, and we counsel them, building rapport. That is very important. If patient is comfortable with her gynecologist, only then she will cooperate with you. And because in today's world, you are perfectly right that they get internet knowledge and about the abusing during labor. That kinds of incidents are there, but I have never touched my patient with any rude hands. Means I have, sometimes they say that doctor just, they beat them, they slap them, there's that kind of thing, but I have never touched patient in that way. I just stand aside. So that is the best way. I can 100% tell them that don't worry, I will not touch you, I will not abuse you, nothing. And you have to be cooperative, because ultimately it's your delivery. So if we counsel them in that way, that and we tell them the labor positions, before that we tell them the exercises which are very important for vaginal delivery. And first of all, we ask them whatever you have learned from internet, maybe about epidural, maybe about vaginal delivery, maybe about cesarean. Some patients come with the mindset that, doctor, I want cesarean at all costs. I don't want normal delivery. I don't want to try. So in those patients, we counsel them. We ask them, because for that, there's a very beautiful model, AEIOU. That is the just counseling. A is for acknowledgement. We acknowledge their concerns. E is we explain them. Whether you have learned from, whether from internet or wherever from you have learned, we have to explain them that what are the pros and cons and inform them what we are suggesting them. And O is, and we have to observe their reaction. And U is ultimately what we are supposed to do, and what is their understanding about it, and how they will cooperate with us or react with us. So during labor, because patients at that time, sometimes patient take it as a horror movie, and sometimes patient take it as a pleasant experience. In our hospital, we have open area also. So I don't make up my patient to lie on bed all the time. I tell them, you just move about, whatever type of activity you want to do it. So if the atmosphere is comfortable for them, and we have asked their concerns and counseled them about it, maybe preparation for the labor means in ninth month we tell them do exercises, meditation, follow the dietary advice, plus household work. Because if you do only exercise, that will be just half an hour or 1 hour a day. But if you do household work along with it, you must be agreeing with me, because for household work they may or may not cooperate with you. Okay, that I don't want to do that, I will do only exercise. But if we tell them, if you do only exercise, that will be the minimum of time, maybe half to 1 hour a day. But if you do household work, you will not realize how much time you have spent doing the exercises. So that type of counseling helps. And in labor room, from the very beginning, and when the patient is pushing or patient is taking labor pains, we give positive feedback to them, never say negative words. And even if the baby's heartbeat is a bit dipping, we have to tell them in a positive manner, better do this, push it hard or lie on left side, whatever the best situation for her, we encourage her to do that. So that gives her, ultimately patient says, thank you, doctor, you saved me. Which
True.
way we have done it, you saved me
Yeah.
and my baby. So
Very,
that is a
very true.
compliment. If we work hard, if we get involved with our patients, we get such type of
Yeah.
response from them.
Very true, ma'am. What you said, communication is necessary at every single step, right from first trimester to the last one. And in fact, moving forward, you advocate reducing unnecessary C sections. So, how do you balance patient preference with clinical safety?
So our main aim is to give healthy baby to a healthy mother. So which way this aim is achieved? That means we have to keep safety over and above patient's preferences. So if we keep what is best for her, if we offer that kind of practice and that kind of service, means if it is a cesarean is needed, we will definitely go for it. But if we can avoid it, then we must avoid it. So we tell them that is our aim goal, to give you healthy baby in your healthy arms, means you should not be suffering from any post delivery sequelae. And that is why we are encouraging you to go for vaginal delivery. Ultimately सदियों से लेडीज करती आ रही हैं, युगों युगांतरों से ये होता आ रहा है. All kind of species, maybe human beings or maybe animals, all are delivering vaginally. It's not, we have never seen any other species going for cesarean.
Yeah.
So that is the way we counsel them, and we encourage them to try. Even then, after trying all the methods, you need cesarean, we will go for it. So
Correct.
keep their safety first of all. That is our top priority.
That is amazing, ma'am. What you said, it makes perfect sense. Keeping safety before anything else, any other preference, it doesn't matter. There, the mother's safety and the safe arms for the safe baby. I love that. And with the rising prevalence of obesity and diabetes, which pregnancy risks are most commonly underestimated by patients, and how can optimizing metabolic health before conception improve maternal and fetal outcomes?
So first of all, we will take up obesity and pregnancy. So when patient comes for preconception counseling, we tell them just in simple language, if someone is coming with 100 kg of weight, okay, just for an example. So we don't talk in terms of BMI, we just tell that if, for example, you are 100 kg of weight, when you become pregnant at this weight, then you will gain maybe 10 to 12 kg more. That is the average weight gain. So then it will be difficult for you to deliver at that weight. Moreover, with the increased BMI or means obesity in obese, there is difficulty in conception. If conception occurs, there is more risk of complications like GDM and PIH. These are the twin sisters like this. So if obesity is there, this twin will also come. Means the patient will high likelihood of getting GDM and high likelihood of getting high blood pressure, means preeclampsia. So that kind of problem is there. So if patient is coming for preconception counseling or otherwise in interval period in reproductive age group, we encourage them to reduce weight. If they have time before planning pregnancy, and if they have tried diet and exercise, all these methods they have tried, but they are not getting the good results, then we can offer them the medical management. Nowadays, these are very much popular for the medical management of weight loss. So for that age group, we can suggest them, and we tell them that you have to plan pregnancy after a gap of minimum of 2 months, like semaglutide or the GLP, GIP analog. So if we have to give them, so we have to tell them. So prior to conception, the counseling is important, because if we tell them the risks, if they conceive at a higher weight, the risk of cesarean is also very high, because if the obese mother may carry obese baby, means the macrosomic baby, or that lady may carry the IUGR baby. So these two extremes are common. So that is why we encourage them to reduce weight and improve their metabolic health. If we conceive in bad environment, the outcome will not be, we should not expect that outcome will be very good. The environment surrounding the pregnancy, the fetus, that is very important. So the everything passes from mother to the baby through placenta. So whatever you eat, whatever behavior, your behavior, even whatever your psyche is there, baby will reflect later on all these parameters.
Yeah, true. Very true,
So
ma'am.
that is our communication. I tell them Abhimanyu's story. You in history you read about Abhimanyu. So your baby will also be Abhimanyu. Whatever environment you give them, that will learn that things only.
True. Very true, and very important is the environment around the fetus, rather, whether it be mental health for the mother or any other health parameters. Thank you so much, ma'am. Moving on to the next segment with Dr. Lotika.
Yeah. So, thank you, Bharti. That was really very nice, the insight about the healthy mother and the healthy child. Now, let's move a little to the next segment, wherein we will speak about some other areas. So, one area is the sexual concern in women with diabetes, postpartum changes, or menopause. And these are very common, yet these are underreported. Why do you think that hesitation around discussing these things persists in our patients?
First of all, I should say it's a society and
Yes.
culture.
Hmm.
Although in remote past, means we should call it remote past, the Khajuraho and all these things, they were promoting sex education through all these miniatures and all books.
Yes.
All these things
That's
was
right.
there. But nowadays, as the society evolved, this thing became shh type of things, just hushing all this.
Yes.
So if earlier upbringing is like that, because this thing is sex is bad and reproduction is bad, you must be acknowledging in schools the chapter of reproduction is there in science books, but it is very rarely taught in classes. If you
Yes.
recall, because
Mhm.
in my practice, I have seen the couples coming to even 10th, 12th pass, but those who have, everyone has done that schooling, and they all give this feedback that that chapter was just hushed. No, no, this chapter is not important. The question will not come. Just cram these questions.
Yes.
So there is no understanding. Even
True.
boys don't know about the menstrual cycle. If husbands
Right.
don't know about the menstrual cycles, girls don't know about the menstrual cycle as well as the fertile period. So that is the starting point where this topic is just kept aside. But
True.
it is very common that till you get married, this thing is, don't talk about this topic. And then the day you get married, you should know everything about sexual education. Hai na? So
True.
what is contraception?
Very true.
What all these things are expected,
Yeah,
everyone should know.
yeah, these are never taught, neither in the curriculum nor in the extracurriculum, and there's always that clandestine secrecy, maybe
Yeah,
some taboo, maybe some negative connotations about
yeah,
talking about this. And you're right, that suddenly she's expected to know everything, and a lot of times, they don't understand what is the fertile period, and they conceive almost immediately and things like that. Okay, what are the common myths or misconceptions about intimacy that you frequently find yourself answering in clinical practice?
So one thing is about that intimacy, because in newly married couples they don't use contraception. One is that myth, because this is the we have to enjoy life, and they come with the unplanned pregnancy.
Yes.
So that is a myth, that they don't they are not educated prior to their marriage. So that is why the preconception counseling and marital counseling.
Hmm.
For the psychological health, marital counseling is important, but for sexual health also it's important.
Yes.
So the one myth is that apne aap sab aa jayega,
Hmm.
because that is
That
the
is
common
true.
thing. And in our
Yeah.
practice, because I
That's
have
right.
about fertility, there's I have already told the fertility window, and when to use contraception, when not to use. So all these things are, because if they are in a regular sexual relationship, the pregnancy will happen.
Hmm.
Sorry, but this doesn't happen. So sorry.
No problem.
So about sorry.
Hmm.
One is about pregnancy and sexual health. And another myth is after delivery, breastfeeding. If the woman is breastfeeding, she will not conceive.
Oh, yeah.
And the second pregnancy comes unexpectedly, even in lactational period.
Yes.
And the sometimes myth related to cesarean. Some patients say, if my wife undergoes cesarean, she will be useless afterwards. Her body will be spoiled, and she will not be sexually involved.
Okay.
So
Oh.
these are the common myths we
Hmm.
find. Sometimes we have seen husband refusing cesarean because he will not be able to have sexual intercourse for few months with her.
Okay.
So sex education is very important at all aspects of life. Even we
Hmm.
have seen the patients in perimenopause. I remember one patient, uncontrolled diabetes, and she didn't have intercourse for last 8 years with her husband when she was diagnosed with diabetes, because if she conceives, the baby will be having diabetes. And
Okay.
that is why she didn't know about any contraception, and they avoided sexual contact for last 8 years. And when she came to me about her difficult marital life, so many myths are related to sexual health and other
Yes.
medical illnesses that
True.
should be
That's
considered. So
right.
these are seen in our day-to-day practice, very common.
Yes, yes, I know. There's unfortunately that's what happens because these things are not in the curriculum, or neither do anybody speak about it, in a clean, clear manner, explaining what it is and what are the precautions and things that need to be taken. So, how do you create a safe, respectful environment in your clinic or to discuss sexual health with your patients? And can you share example where you have probably discussed with your patients and it has improved their quality of life?
Uh, about this, because I have I have done that fellowship in sexual health, so that is why the
That's
patients
right.
come, because that is on the board. So patients come for that counseling too,
Yes.
and that is very helpful. For these patients, those who have come specifically for sexual counseling, means just like we have patients of non-consummation of marriage.
Mhm.
So that is also common, but they come with the infertility. So we give them special time, those in which we clear cut find that is the problem. But for other patients, when we examine, being a gynecologist, I have advantage of examining all my patients. I
Yes.
don't leave any patient untouched for the examination part, because
Yes.
that is our protocol. We have to examine their breast for any incidental finding and their gynecological checkup. So at that
Yes.
time, we just ask them, if you have any concern about your sexual health, let us know. It's not in the
Mm.
same visit, but at times, if we are open to it and we ask them about their sexual health, even if they
Mm.
feel shy, they don't respond to us in the same visit. They in next visit they say, doctor, you were asking about,
Yes.
so I have these concerns.
Mm.
My partner is not using contraception, or my partner is abusive. Whatever it is, the sexual problem, they just let us know.
Mm.
So the special time given to them, special counseling session given to them, and that is
Mm.
beyond just my obstetric OPD. So,
Okay.
huh. So, and
So,
for every patient we ask this, even for the young
mm.
girls, because we have to counsel them about cervical cancer prevention, for their
Yes.
HPV vaccination. So at that time we ask them and educate them about their sexual health.
Yes, that's right. No, that's very nice because see, if we as doctors don't keep that window open for them, for our patients to discuss, then unnecessarily they, look for some quacks or people who, may not necessarily give the right kind of advice that is required. So this is so nice. I will now hand over to Dr. Rukaiya for the next segment. Uh,
So ask them open-ended
Thank you, Dr.
questions. Just
Yes.
yes,
the answer
yes,
should not be yes
yes.
or no. Answer should be open-ended from their part.
Open-ended. Yes, it's very important to put that
Yeah.
question in that, is everything okay and whatever, and then let them come out with their stories, and that's really nice. So, Dr. Rupaya will take over the next segment.
It's so wonderful, when you put up this. So even as diabetologists, a lot of times patients come to us. A man will come and say about an erectile dysfunction, but very rarely a woman come and says that she also is not able to get an orgasm, or she doesn't feel it's a right itself to get one. So I think asking the question by the doctor per se opens the communication doors to them, that okay, this can also be discussed if they have any concerns on that front as well. uh, Moving forward, we are going to be talking about in this segment is perimenopause. This is for each one of us here, and also for our audience who are typically of this age group that we are looking at, and the transition that a woman goes through during menopause. So many women, or rather, I would say even my friends, frankly, whenever I go to, they will just say, how they feel different during menopause. They're not able to actually say, but they just say, they're physically, they're emotionally different. And how do you help the patients understand what is happening in their bodies during this transition?
This is a beautiful phase of life, but it's really very different. The phase itself is very different because no one wants to be old and no one wants to feel old at any stage of life. Even today, मैं खुद ही कहती हूँ कि मुझे बुढ़ापे से डर लगता है. So if sometimes the any woman, if she is getting the means irregularity of her menses, so first thought comes to us, oh, is it around menopause? Is it too early for me to stop? So I will not be having womanhood with what I am enjoying. So all
Yes.
these concerns are there. So to counsel them for different kind of complaints, they are coming to us. Maybe they are sexual health related, or maybe they are menstrual cycle related, or maybe endometriosis or fibroids. That kind of concerns may be there. Means dyspareunia or dysmenorrhea. So in those cases, if the first question they ask, doctor, is it menopause, or I am heading too early towards menopause? So in those cases, we just tell them it is a phase. We have come as embryo. This was decided till when we will get our menses. So
Correct.
it's not now. It's not afterwards. Maybe our lifestyle has affected it, whether it is coming early or late. So this is a transition. We can make it beautiful. So this transition, someone get transition just like steep downfall, and someone gets just a bumpy road in this.
Right.
Sometimes they feel better. So
Accepting one thing.
yeah. So the age-related hormonal changes, the estrogen changes, related changes, because estrogen is coming from, that is released, the order comes from our brain. So that affects all parts of our body. It's not only the reproductive system. It may be affecting sexual health, or it may be affecting our psychological well-being. So that is also because the estrogen, oxytocin, all these hormones are related to our sexual health also, as well as our mental health. That is why men are different and women are different, whatever the way they think. So this transition, so we have to counsel them. We are with you. Everyone goes through this phase, and it's a beautiful phase. Everyone should go through this phase happily.
Yes.
So this is a time, because this may not be related to their menopausal transition. This may be related to their family responsibilities also, because at that stage usually the children are going to hostels, further studies. So that we have to ask their that aspect of life also, is it the empty nest syndrome or it is a menopausal
Right.
transition, because these phases overlap. So
Yes.
if they feel lonely, so they can just cultivate their hobbies which they had left because of their family responsibilities in the back seat.
Right.
So
So, ma'am, these symptoms, generally they complain of weight gain, they're complaining of sleep disturbances, mood changes. I think mood changes, the couple, both of them complain about the wife's mood is changing. The irregular cycles, which keep happening, and they all come together, sometimes together, sometimes in different phases. So, what would be the first practical steps that women should take to protect, their metabolic and the hormonal health?
So first of all, they should change their lifestyle for the betterment.
Okay.
Lifestyle is it's not only the eating habits; it is related to exercise pattern also. Means the, as we say, that in the middle age the person becomes calmer. Means the yoga and meditation, these are
Okay.
very helpful. Yoga, meditation, and changing your dietary habits means just increasing their proteins, calcium intake, as well as the fruit intake, because the colorful fruits increase your mood. So that kind of diet and exercise pattern and yoga meditation. So these are the lifestyle changes. And if they are troubled by their irregular menses, we can give them low dose hormonal pills that will keep them safe from the contraceptive aspect also, because in the middle age there is, because of irregular periods, there are chances of unplanned pregnancy or that pregnancy surprises. So
Yeah.
the low dose hormonal pills, these are available, which help their cycle regulation as well as improve their sexual health. The pills with estrogen and drospirenone, these improve their sexual health also. So with this, when their mind is clear of all these stresses, their mood will improve. And if they, and as we say, the sex begets sex. If they start having regular tension-free sexual activity, that will improve their sexual health, relationship with their partner, and the psychological benefit of it. And as well as so if you improve your physical activity and exercise dietary pattern, your health will be better. The weight gain, the abdominal weight gain, that will also reduce, because otherwise, because of hormonal changes, this has to come. But this is the way in which we can overcome it, with the diet, exercise, as well as with the medications.
Fantastic, ma'am. So because the common concerns which come, so does this hormonal replacement therapy, what would be the indications? But also, I would like to know what would be the contraindications. Like, is it meant for everyone hearing it today that, okay, if I have mood changes and, I'm going through this, maybe some irregular menstrual phase of life, would it be given to every person? Or are there specific indications? And also, those symptoms like urinary leakage, vaginal dryness, and reduce sexual desire, the only indications for hormonal replacement therapy?
See, nowadays, if menopause is happening, perimenopausal changes are happening at a normal age, usual age of 40 plus, means around 45 and that age group, which is the usual age group. In that case, we give them menopausal hormonal therapy. Now we
Okay.
don't call it as hormonal replacement therapy for that age group. Hormonal replacement therapy is given in those cases in which those who have attained early menopause, means POI, premature ovarian insufficiency cases. So that term is used at that stage. So menopausal hormonal therapy is the main indication, is the phase when there is transition, as well as once they have attained menopause and they have vasomotor symptoms.
Okay.
Because with the menopausal hormone, MST, menopausal hormonal therapy, that is very effective in vasomotor symptoms. So for vasomotor symptoms, we can give short course, and this can be given for bone health also. Bone health, cardiovascular health, for all these conditions, if uterus is there intact, means if patient is having uterus, so in those cases where estrogen and progesterone combination is to be given. But if for any reason the woman is hysterectomized, in those cases we can give only estrogen, because basically the estrogen deficiency is happening during menopause. So if we replace it, all these things will be in place. So
Right.
yeah, for immediate relief, the vasomotor symptoms respond very well, and it can be given up to 5 years or up to the age of 60 years. Prior to that, not beyond the 60 years of age, whichever is earlier, or how long the patient wants to take it, she can take it.
Okay. And any contraindications, ma'am?
So
Somebody
coming to contraindications. So if those who have any thromboembolic event in their earlier age, or some prosthesis, that is the cardiac, some surgery is done. So in those cases, we would avoid these this medications.
ma'am, now with the recent increase of cancer, uh, even gynecological, uterine, and ovarian cancers, would this hormonal therapy be helpful, or the patients are at risk of higher hyperestrogenic states that they are in?
This is one thing, means there are different categories in which we can use different type of hormonal therapy.
Hmm.
That was about the estrogen and progesterone combinations, but other categories are also there. There is tibolon, another categories. Tibolon, that is a estrogenic, androgenic, and progesterogenic. All these components are there in that tibolon. We just move stepwise. So,
Acha.
no, because it's not, we can't, if we have to talk about for general, so it's not general, that is categorized. If someone had CA breast, for CA breast patient who has taken the chemotherapies and all these medications are going on, and she is getting vaginal dryness. In those cases, we have to give topical, means vaginal cream is to be given. And if concern is only the vaginal dryness and urinary symptoms, in those cases, we can give local therapy, means the vaginal creams, Evalon cream is there. So estrogen creams are to be applied uh, daily for 2 weeks, and then twice weekly for 2 months. So that is the usual regime we can follow. That is for that. And if for bone health we need it, so other medications are loxifene and other bone health, the medications can be started, and tibolon can be given for the sexual desire. And because at this phase, if patient is whichever complaint the patient is complaining, for those indications we have to give specific treatment. So
Wonderful.
for sexual concerns, we can give estrogen, the E plus P combination, that is the estrogen progesterone combination, that is also good. And if sexual concern is because of vaginal dryness, then the local therapy will be more effective.
Right. So, ma'am, beautifully told, explained, wonderful in this segment, how it's very important first to accept this transition. It may be a smooth road or a bumpy road, and just accept that this is a transition. The day you were born, being a girl, you knew that this would be a part of your life. And two, it's very important to have a holistic approach in terms of your lifestyle, your diet, and your exercise, which is going to make this journey smoother. And if still you may have problems or specific concerns, then yes, hormonal replacement therapy is the right approach by a right doctor in guidance. It can be done also. Thank you, ma'am, so much. Over to you, Dr. Ritu, for the next segment.
Thank you so much, Rukia. And I think yes, ma'am, totally. It's such a learning session for us today. I was actually just taking notes because this is a topic that is very close to my heart, and I'm sure to a lot of women as well. Because women don't even voice up these things. That is where the entire dilemma begins. As you rightly said, it is something that is still a part that people feel it is intimate and only to be kept to their own hearts and probably goes away with them to their graves. So thank you so much for educating us on that. We have quick 2, 3 questions on the audience aspect. One of them, which you have touched based already a little bit, but yes, it is important. Where we're talking about when you're looking at women and we're talking about sexual health. So of course, yes, it is. Any tips that you would want to give? Quick 2 tips that women can have these conversations with women in terms of how they are having their sexual health otherwise, because this has impact on mental health as well.
See, even if in the fastest of friends, best of friends, no one will open up about their
Absolutely,
bedroom.
ma'am. Yes,
So that
bilkul.
is the thing. But with doctor, they confide in. They just
True.
tell them, but because from there they just need help and guidance.
Yes.
With their friends or in any other public place, or otherwise they remain anonymous. They complain
True,
to,
true,
because
ma'am.
there are groups where they just anonymous because they don't want to disclose their identity.
Correct.
So for our patients, I, because everyone has the, those who are in reproductive age or otherwise, if you are a woman or a man, this is a biological need.
Yes, that's so true,
So
ma'am.
yeah, this is natural process. So so if you have any concern, you should just inform your, means from patient's point of view or from other concern. If you have any concern, you just let them know that I have some concern. I want privacy. I want to
Right.
discuss it in detail. थोड़ा सा आप भी करो, कुछ तुम चलो कुछ
समझ
हम
में।
चलें मिलके पूरी
सही बात है,
जर्नी करें. सो
सही
दैट
बात है।
वे, because I have seen village patients, they open up very clearly. They just tell them, they tell us that what are their concerns. But for the urban educated, they just become hesitant. But nowadays, the younger generation is still again opening up. But
Mhm.
first, they should also voice their concerns. We are there
Absolutely,
to
and
listen.
ma'am,
We are there to help, but they should also come up.
absolutely. In fact, ma'am, truly, I'm sure some of us also must be experiencing this, which I do, is a lot of times when I see patients who come up and talk about their own sexual health, the women per se, it is only, the complaints are more like, my
Yes.
husband is not happy with me. My husband says
Yes.
XYZ. So
Yeah.
it is still a guilt and it is still the husband pushing for the woman. And in
Yes.
fact, otherwise, if you look at it, last 6 months, they are not controlled on sugars or 1 year, but it is the abstinence from sex which brings them to follow up. And I think that is again, the push from the man, not the woman herself. It's very difficult for them to accept that it is also their biological need. So I think a lot of awareness there, maybe, I don't know, from our sides should be helpful, I guess. So I really love the way you said that kuch kadam aap aage आइए, kuch kadam hum आगे आए. But yes, it is important that they speak as well. है
Now
ना?
the husbands are also coming to me, means husbands are also coming कि मेरी wife को समझाओ.
हाँ, सही
Uh,
बात है मैम, बिल्कुल, व्हिच
तो
इज़
वो
गुड,
भी,
व्हिच इज़ गुड। बट हाँ, मतलब मैंने जैसे कि है ना कि औरतें ही अगर नहीं समझे तो फिर आदमी बोल भी दे, हम बोल भी दें, बट व्हाट डू वी डू
people
अबाउट इट
means husbands
अनलेस
come
दे
and they
एक्सेप्ट इट।
say, yeah, yeah. Now the society is changing. That is why they are coming. My wife is doing this, that, whatever it is. Even for vaginismus also they come. Couples come, but first the husband comes and talk to me about it in detail that what is their problem.
Correct,
So
correct.
we
Absolutely,
have
ma'am. And in fact, I feel vaginismus, in fact, I still remember the first time I heard about it. I took some time to even learn the word and understand and Google it out because I still feel there is not much awareness about it. And women just feel that it's just a procrastination. They feel it's okay. Once we are 35 plus, we've had kids, we are done with it, and it is just a tool for the pleasure for men. They do not understand the complications and the otherwise issues associated with not having sex.
So I tell them this is
Mm.
for procreation and
Correct.
recreation both.
Absolutely.
Yeah.
Very well
So
said, ma'am. Very well said.
mhm. And relation, procreation, and
Mhm.
recreation. So these are the three aspects. So if you
Mhm.
don't have it, you had it for procreation, you have it for, now you have it for
Right.
recreation, and that recreation will improve your relation with your partner.
Mhm. Amazingly said, ma'am. So my next question from the audience is: as women doctors balancing demanding careers while navigating our hormonal transitions, what aspects of self-care should we generally prioritize for long-term health and well-being?
What I have preached, I practice that too.
Wow. मैम ट्रस्ट मी हमारा पूरा ये जो प्लेटफॉर्म है इसका जो नजरिया है वही है कि एज डॉक्टर समटाइम्स वी प्रैक्टिस समथिंग वी प्रीच समथिंग एल्स सो आई थिंक दैट इज अ वेरी गुड थिंग दैट यू सेड दैट यू प्रैक्टिस व्हाट यू preach so I guess yeah super answer on that. So with that, I think I'll quickly move on to the next segment, ma'am. This is going to be the fun segment of the whole session of today, the episode of today, which is the rapid fire segment. So I'll be shooting few questions onto you, which you can answer either in one word or one sentence to be the quirky one. So are you ready, ma'am?
Yes.
Okay, so let's go. So the first question is normal delivery. Do you think it's science or mindset?
Science.
Super. When you look
I
at
delivered,
menopause,
I delivered normally, so I encourage my patients too for the same.
lovely, lovely, ma'am. Next question, ma'am. Menopause. How do you look at it? Do you think it is the ending or the beginning?
It's beautiful beginning of new phase of life.
Lovely. I love that word. Third question, ma'am. Sexual health, taboo or therapy?
Therapy.
Super.
Relational therapy.
I would take that one. Recreate, procreate, and relationship. That
Yeah.
was beautifully done. Then one daily habit you would want people to learn, women to learn for hormonal balance.
That lifestyle modification.
Wonderful, wonderful. And one of the health issues in women which is most misunderstood as per you.
Dysmenorrhea. Endometriosis. Yeah.
Sure,
Because
absolutely,
that was
absolutely.
taken
I think
as
people should
this is
start
normal.
talking.
This is normal. And endometriosis is missed with that.
Yes,
And
yes,
another one is
absolutely.
PCOS too.
True. But I feel, ma'am, still at least PCOS girls have started talking, but
But
while
they
they
don't
don't
take
understand much
action.
of it.
They,
Yeah, yeah,
they
yeah. That's
don't
true
take action.
again.
They say, Doctor, I have PCOS, but I
It
don't do
is a
anything
fad.
about
It
it.
is a fad. I have it.
Uh,
Okay. Then doctor burnout. Do you think it is real or exaggerated?
it's real.
That's so
Because we
true.
have to talk to so many people and
Yes,
listen to
yes.
them. You burn out. Definitely, you are also a human being.
Absolutely.
God doesn't know
Absolutely.
that you are a doctor. God has sent you as a human being.
Absolutely. And it's very funny because, sometimes patients will come and say, अरे आपको बुखार हो गया? अरे आपको ठीक नहीं था? आप तो डॉक्टर हो. Like, hello. उसके पहले मैं इंसान हूँ. So I
So
guess
that is
yes,
what I
definitely
tell
yes.
my patients same. Say,
But ma'am, I must say you're very enigmatic and talking to you itself is therapeutic. So I'm sure your patients are blessed to be speaking to you as well.
thank you.
So my next question, Dr. Bharti's preferred topic, women's sexual health or OBS or gynae? If you have to choose
I
one.
love all. If I have to choose the one, women's health in toto.
Super, wonderful, wonderful. And last question, ma'am, legacy. How would you like to be remembered?
I would I would like to be remembered as a good human being who has touched
क्या
so
बात
many lives,
क्या
who
बात है
who has helped many lives to come into this world. That is the way.
Wonderful. It is like hand holding and getting, women to deliver their own mini me's. So that is a wonderful thought, ma'am. Thank you so much. You've been absolutely enigmatic. Like I said, sharp, sincere, and truly authentic. Just exactly like what the platform vibe stands for. So thank you so much
Thank
for the
you.
wonderful persona that you are.
Pleasant,
And
really.
I hope you had fun too.
Yeah, yeah.
Super. Then I'll pass over the segment to Dr. Rukia for the closing formalities.
Thank you so much, ma'am. It's been, as we close today, our Vibe Hexalog. One thing that really stands out for me, especially, was how you look at women health in toto. And that is the comprehensive health which comes across right from your training and which actually motivated you to study further. And, you have tried to wear every cap in which you are able to deliver the best treatment for your patients, and there is absolutely no leaf unturned where you have not taken efforts for it. You have gone through the topics which are not heard of, not spoken in whispers, and you have brought that out in open. And it's been so wonderful to learn about you, about the menopause, about how what most important, I think my learning from today's session was patients need therapy by healing hears. So I think that healing here is extremely important. And women invite women, and it's collaboration and it's not competition. So that's been so wonderful to have you here. Thank you so much. Even all our viewers, this success is being personal. The growth is continuous, and your limits are often just the beginning. So thank you, ma'am, so much for being here today. Over to you, Dr. Pranjali, for your sharing.
So first of all, I like the way she was talking, especially Hindi. It is very soft and good to listen to the words which
Madhur,
match.
Madhur,
Yeah,
Madhur.
Madhu. Yes,
Madhur,
yes, exactly. So, and ma'am, there are multiple things, but what I have learned is holistic care for women. We will not be sitting just to, like, suppose if I'm treating diabetes, it is not only diabetes, I need to look after all the angles and I need to listen to the patient and then decide the line of therapy. That is my takeaway from today's session, ma'am. Kavita, for you.
Thank you, Dr. Pranjali. Ma'am, today I learned that awareness is so important, whether it be prenatal, postnatal, premenopausal, perimenopausal, all of it. And the doctor comes in to every single step. So, us being best friends with our patient, it helps the patient, and as well as it helps us to avoid any specific complications they may think of because of Google or any other friends or any other random relatives. So it's better that we have the connection with those patients directly than sending them to any other rather sources. Dr. Ritu.
So I think I just love the way ma'am said recreation, procreation, and relation because, anything that you do with passion, whether it is work,
yeah,
whether it is health, or whether it is the issues that we are handling, I think that is where the entire success story lies. And that is what we need to pass on to our patients and we need to imbibe while practicing as well. So when we're talking to patients, we probe that, how and what is the issue that they're actually addressing. Sometimes we may see that mental health is the issue, but the underlying issue is actually the sexual health at home. And therefore, building these relationships and making it as a regular habit as compared to just a task to be done at the organic level. I think those are things that I would take away and would definitely want my patients to benefit from these learnings, ma'am.
yeah. So I'll also add my learnings because so I like the way you said that when a person comes for a delivery, it's not a short-term relationship. Your goal and your vision is that you give the woman a healthy baby in her healthy arms, and that is so powerful, because most people just mechanically just do a delivery, but they don't think about the health of both the mother as well as the child, and it's really so inspiring and motivational for to hear that you see the all the aspects of the whole process, and not just then but even afterwards. Yeah, so that's it. So
Practical, pretty comprehensive women health. I think,
yeah,
yeah.
yeah, that's right. So Rukaya, you will.
Wonderful.
Yeah. So we can end with our signature vibe. Bharti, can you put your fingers together? At the count of three, we do be the vibe, be the vibe,
Be
Three,
the vibe.
2, 1, go. Be
be
the
the
vibe.
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 Thank you so
So
much, ma'am.
thank
Yes,
you so much.
ma'am.
It's
Thank you,
really been
Bharti,
so
so
nice.
much.